The need for population health management systems has never been more important as we move ahead into restoring services, reducing backlogs, and identifying unmet need, all while tackling inequalities in access, experience, and outcomes. Our population health platform uses the rich data held in our shared care record to produce in-depth insight at population, community, cohort, and person level. The insight drives actions such as enrolling identified individuals onto a remote monitoring program, where clinicians can drill down into the underlying shared care record and patient's self-record onto their integrated personal health record. In addition, analytical tools measure the impact of interventions, and the results are fed back into the shared record, closing the loop and creating a 360-degree solution. Using our population health tools, ICS leaders, public health and care professionals can track key aspects of care delivery and forecast the impact of changing needs on operational demands. Use these insights to take action. Identify groups of vulnerable people who would benefit most from proactive care and target limited resources to where they are needed most. Improve existing care pathways and establish new ones, with a focus on offering more community-based care and enhancing patient outcomes. Study the impact of interventions and use this insight to drive best practice. An important feature of our population health management system is the ability to see real-time reports and dashboards covering bed capacity, cancer trends, and disease profiles within communities, for example, and to use that data for action. So let's look at the key functionality that our population health solutions support. Using the cohort mapping engine, the enhanced case-finding tool brings together data from all available datasets. Users are able to create and save searches to identify patients in need of intervention, thus supporting the focus on the treatment and prevention of illness outlined in the NHS long-term plan. The patient lists can also be ordered so that those who have the highest need can be prioritised, and risk stratification algorithms such as the Johns Hopkins ACG system can also be used to support predictive modelling. By using the tool, local commissioners can support the agenda to help people to live longer, adopt improved healthy behaviours, and reduce the demand for and delays in treatment and care. Security is embedded into the tool, ensuring identifiable data can only be viewed by users with a direct clinical relationship. Results can be exported to allow further analysis or importing into GP practice systems. The COVID virtual ward dashboard can then be used to allow for active remote monitoring of at-risk patients to ensure escalation when necessary. The Virtual Ward module on CareCentric supports information sharing of patients managed in the community. Here we can see the dashboard reports on patients who are currently enrolled, providing demographic, COPD, and a history of reported results to allow the patients to be managed remotely through oxygen saturation readings taken by the patient using pulse oximetry. Finally, another example of the many ways our population health solutions support workers in their day-to-day management of patients. The unscheduled care dashboard can be seen here, providing community matrons with a list of patients who are on their caseload but who are currently attending A&E or have been admitted to hospital as an unplanned admission. This dashboard can be adapted to work from different caseloads for different teams, where up-to-date information regarding unscheduled care may be operationally crucial. For example, crisis, mental health, care home and children's community teams who perform home visits or community appointments can check if a patient has been admitted before attempting a scheduled visit or appointment. Already we can see real-life examples of how our solutions are improving care. The National Immunisation Management System, or NIMS, is the IT software provided by the System C and GraphNet Care Alliance that supports the management of the flu and COVID vaccination programs across England. NIMS is the National Immunisation System of Record and provides data for Public Health England, NHS England and at ministerial level. GraphNet's Population Health Solution identifies the prioritised patients to be vaccinated and the dashboards for reporting and analytics to manage local vaccination programmes. Across Cheshire and Merseyside, GraphNet's Population Health Platform was rapidly deployed in 90 days to inform the region's response to COVID, including its management of the Liverpool mass testing pilot. The work was led by the Combined Intelligence for Population Health Action Programme, also known as CIPHER.
The Liverpool pilot of open access, community-based testing for the virus that causes COVID-19 has now tested over 160,000 people, and the test has picked up over 1,200 individuals who did not know they were carrying the virus. All this work needs intelligence on what works and what doesn't in a fast-moving pandemic. CIPHER has been extremely valuable for the teams on the ground and national policymakers to adapt their tactics and plans according to the data. Each week, the CIPHER intelligence is used to tune local and national plans to gain as much COVID-19 risk mitigation as possible from the tests available. This intelligence-led strategy will save lives and livelihoods.
At Frimley Health and Care ICS, care professionals are using their Connected Care Shared Care record to proactively support COVID-positive patients on their oximetry at home and virtual ward programs. By combining shared care record data with test and trace, public health and lifestyle data, clinicians can identify and reach out to those individuals in their population most at risk from the complications of COVID, targeting care to where it offers the greatest benefit. Using shared care and personal health record data intelligently, integrated care systems will be able to operate in a more agile way, prioritizing care, adapting and scaling up new services as demands change.